I want to welcome everybody to the Vaccine Confidence in Communities of Color that is sponsored by Aetna. We have an esteemed panelist or panel here to talk and to dispel many of the myths and misconceptions that exist with regard to vaccination in communities of color. The reality is that we are woefully underrepresented in terms of populations that have received the vaccine. As America goes toward what is called herd immunity at 70% vaccination, the reality is that our white and our Asian counterparts right now in the country are close to 60%. That number almost goes in half when it comes to Black and brown communities. Joining us today to discuss the necessity for vaccinations and having confidence in vaccinations in communities of color are Cook County Commissioner Dr. Dennis Deere, Dr. Lakshmi Emery. She is with Aetna Better Health of Illinois. We also have pharmacist Edwin Muldrow with Delcar Drugs, the city of Chicago's oldest Black pharmacy, by the way. We have Dr. Larry Dowling from St. Agatha Roman Catholic Church. We also have Dr. Rita McGuire, who's an OBGYN over at Roseland Hospital. Okay. We also have Elba Aranda-Suh, who is with the National Latino Education Institute. And I believe that covers everybody. I want to begin first because we're talking about communities of color here. Yes. And it doesn't just signal out the Black community, but it also includes our Latinx as well as Hispanic communities. What exactly are you trying to get across, Elba, in terms of having people that maybe didn't even have confidence with regard to the census because of misconceptions? What are you trying to get across with regard to building confidence in the Latinx and Hispanic communities?
Well, I think it's important to continue this intensity and awareness and education and in a multilingual and multicultural way, because we're looking at various generations that understand information differently, right? So my mom and dad might look at the information differently than I do, or maybe even my kids. But the one thing that I think we all have in common is we do listen to our families. So when we educate members of our families, we're educating a larger amount of communities. And I think education and awareness in a culturally sensitive matter is really important. I support the importance of multicultural education and marketing and awareness because in order to educate, we have to be able to speak to our community in a way that is going to be comfortable and gain the confidence. So we're talking about confidence. And as a community, we're very brand loyal. So when we're very brand loyal. So when it's really important that working through our leaders and those that have demonstrated results, in other areas, also take that leadership, to the issue of vaccination. So we kind of take it for granted that, everybody already knows the importance, but we can't take that for granted. So any opportunity that we have to share its importance, we want to take advantage of that. This stems, we're talking about reopening now, right, and getting jobs. Well, guess what? Many of the companies, especially those in the essential workforce, require that you get vaccinated. Yeah. So it's a big part of the reality, of this world that we're living in. And so we can't take for granted that everybody understands just how simple actually it can be. I think that's the one thing, is that not making it so difficult. And today, by having 3 days, available and free, is a perfect example of how we can share the message and say, it's really easy to do, it's not a scary thing to do, and you're saving lives at the same time.
And we also want to focus on those that are watching this particular panel discussion or also listening to it, because we're here to dispel those myths that produce a lack of confidence. And when it comes to the Latinx and Hispanic community, the reality is that sometimes, since it's a government that is encouraging vaccination, there is an inherent fear that if I may be undocumented, or I have a question with regard to members of my family being undocumented, that this provides an entryway for them to come after me. What do you say to that?
Well, I'm not from the government, and you're not going to be asked, those kinds of questions when you go get vaccinated. But you will get self-assurance that what you've done is a good thing for your family and the greater community that surrounds it. Indeed,
that is an excellent answer there. I want to go first to Dr. Emery. And what is your role with Aetna, and why is it so vital for them to sponsor an event like this?
Thanks so much. So I am actually the Chief Medical Officer of Aetna Better Health of Illinois. And so we're the health plan in the state who provides services to Medicaid members, about 400,000 members throughout the state of Illinois. And so the reason that I'm here today is because I want to encourage our communities to come out. I think you did an excellent job introducing the topic and laying out the problem that, we're about half as vaccinated as the rest of the country. Yes. In terms of the Black and brown communities. And so I think it's just incumbent upon us, as leaders, as clinicians, to encourage everyone to come out and to provide the information that people need to feel comfortable and to feel safe and to know that they should be vaccinated. I've been vaccinated, my entire family's been vaccinated, my mother, my daughter who's a teen, my husband, our entire household's been vaccinated. We had no side effects and no problems, and we're safe.
And many times, you are a doctor as well as Dr. McGuire here. Many times people will say, oh, I felt a little woozy or I had a fever. The reality there, and I'm not the doctor, I don't play one on TV, but the reality is that in a way that's a good sign because it shows that the vaccine is actually working in you.
You are right. Those are signs that your immune system is being revved up. So, and these are things that you get with other vaccinations too. For instance, the flu shot. Some people
That's right.
Yeah, a little achiness.
I felt like I had the flu after I did my first flu shot.
Right.
I was like,
right. But those things are good, as you said, because it means your immune system is working.
Indeed. I want to go to Dr. McGuire because there is a resident population that exists among females. We know that the leadership role that Black women play, but Black women are also the caregivers, and they are the ones that birth our children. And yet they are also woefully unrepresented or underrepresented when it comes to getting vaccinations. What is the number one myth that Black women that are pregnant or are postpartum that they have with regard to getting vaccinated?
Yes, well, thank you so much for having me. But, the community of the pregnant moms really have to understand that the vaccine, one, is not a live vaccine. So getting vaccinated and pregnancy is very safe. In fact, when we talk about the high-risk community, pregnancy is one of them. Pregnant women die 22 times higher than those who are not pregnant. And so just being pregnant puts you at risk of being severely sick, hospitalized, and even death. It also, being pregnant and getting COVID infection, puts you at risk of preeclampsia, infections. So we want to get the word out that when you're pregnant, if you're thinking about getting pregnant, if you are postpartum and breastfeeding, it is safe to get vaccinated. In fact, the other side of the coin, of course, is getting COVID. So the risk of the vaccine versus the risk of getting COVID and dying, potentially having a severe infection with hospitalization. ICU admission is very high in pregnant women. So pregnant women, it's safe to get vaccinated. Breastfeeding moms, it's safe to get vaccinated. Those women who are considering pregnancy, it's safe to get pregnant. So we need to get them vaccinated.
Yeah. One person that can offer firsthand testimony in terms of actually having COVID is Father Dowling. Father Dowling, first of all, what was your experience like with regard to being infected with COVID-19?
So essentially during the whole month of October of last year, I contracted COVID, actually from a small gathering of people where we were masked, but where we had to take the masks off to share a meal. A couple days later, one of the members had sent it out to the group that she and her mother had contracted COVID, and so a couple days later, I started feeling all of the symptoms, and it developed pretty quickly into deep fatigue, a fatigue like I've never felt before, and in my case, very strong abdominal problems and pain, and a few of the other side effects or other effects of COVID as well. My encouragement to people is never ever have to put yourself through that, because even though I wasn't hospitalized, it was one of the most, one of the hardest, physical periods in my life, and so I want to encourage people to get the vaccine. And again, there's all sorts of concerns, in terms of history of experimentation in the Black community, but this was trials done in every community, in every demographic, in every ethnic and racial group, and so we need to recognize that, and also as a person of faith, that we need to do everything we can to preserve this gift that God has given us, which is our body, that has so many wonderful ways of expressing love to others, but we also need to do it for others. And to be able to do that. So again, having gone through it, that experience makes me more emphatic about please get the vaccine, because you don't want to go through what I went through, and you don't want to go through what many of my parishioners went through. Some who were hospitalized, some who did die, and to have to do those funerals and all those sorts of things. We want to preserve our families. We want to preserve especially the great gift of the African American family, and so that's my appeal to everyone in regard to this, out of my own experience.
You're also a walking testimony in terms of not believing the hype, saying that, well, hey, I've had COVID, so I don't need to get vaccinated. Did you follow that advice?
No, I got vaccinated immediately when I was able to do so, and absolutely, and encourage my parishioners to do the same, and I think probably 90% of our parishioners have been vaccinated, and so, but we work with a lot of people in the community, a lot of people who on the streets, and so our encouragement, the challenge is converting them, if you will, and but that needs to come from people off the streets who also work the streets, in positive ways, who are trying to work within the community, and so those are some of the allies that we need to engage for them to get the vaccine, and them to say to the rest of those in the community who are resistant to say, I got it, you need to get it, because we need to keep up the fight. We need to keep up the battle for equality, and we can't do this if more people are dying.
In terms of keeping up the fight, we have come out the gates flying, Congressman Davis, in terms of during the current administration, the Biden administration, they were more than able to meet their targeted deadline of having 100 million or giving out 100 million doses during the first 100 days of the administration. In fact, they doubled that amount. But yet, recently, Congressman Davis, it seems as though vaccinations have hit a plateau in terms of getting to that magical herd immunity. What exactly is being done at the federal level that is assisting in terms of making sure that everyone that is reticent about getting vaccinated, get vaccinated?
You know, I sometimes, Darryl, try to be a serious thinker. And I say that because I recognize that there are no simple solutions to very complex and challenging problems.
Yeah.
And so trying to find an answer to this problem right now requires looking at 400 years of problem creation. And so answering it in 60 days,
Yeah.
3 months, is going to be hard. But I do want to commend Reverend Johnny Miller for letting us be here. I want to thank Aetna for the effort to help educate and communicate and provide opportunity. I have worked with, for, and among poor people
Yeah.
all of my life. I've never worked anywhere where I wasn't working with low-income people. And I'm been doing it a long time. Trying to get people to do things. Leadership is the ability to get others to do what you want them to do, but because they want to do it. And so we've got to help them want to do it. We think of the groups who are not being vaccinated, and we say young adults. Guess what? I don't know any 25-year-old medical doctors who are not being vaccinated.
Yeah, all of them are.
I don't know any 26-year-old PhDs who are not getting vaccinated. I don't know any 30-year-old individuals who have degrees in biology and science, and individuals who are what we call middle class oriented. Education is the absolute key, because education means it's not just a matter of knowing something, it's a matter of doing something. And so I'm encouraging, and all of us, I think, are encouraging individuals to really understand the myth that's in some people's minds in terms of the vaccine doing something to you, or they did something to you at Tuskegee. Yeah, they did. They didn't give you the medicine
That's
that
right.
you thought you was getting.
That's right.
They did something to you, all right. And that
They broke their Hippocratic oath.
an indelible thought that gets translated all the way down. People were telling me about it when I was a little kid. And for a moment, I thought there may have been some wrong with the vaccine. After I started studying this stuff, I discovered they didn't give them the penicillin.
Yeah.
That's right.
And so don't think the vaccine's gonna hurt you. What's gonna hurt you is not being protected. And so we just gotta keep the effort going, keep working, and keep trying. And I think that's going to make the clock kind of go on a little bit, but I think we're gonna turn it around.
And that's why we're here.
Yeah, I think we're going to do it. And yeah, things start. The money that the federal government has allocated, that has as much to do with the vaccine.
That's right.
Because if you don't have the resources available, nobody have to pay to go and get the vaccine. We allocated the money out of the federal treasury to pay for the vaccine. And we're trying to help people in other countries, in India. I've been engaged with communities sending not only money, but equipment to India, and we're trying to find it right now. We're trying to find hospitals that may have equipment that they are not using in this country right now that could be used in India. So I'm delighted with the effort, and I think we'll overcome.
And I think it goes without political affiliation to say that the government has done a great job at making sure that everybody has access to vaccines. The reality is that you got to change the mindset, and that's really why we're here. That's why Aetna is sponsoring this, is because we have to change that mindset. It doesn't cost you a dime to get vaccinated. In fact, if you're in Ohio right now, I don't play the lottery, but you get a lottery ticket.
I thank you, Darryl, for saying that. Let me tell you the reason. Many people are afraid or skeptical about acknowledging what the government does or what the difference it's made. I'll go somewhere and they'll be praising everything that's going on.
Yeah.
And I'm saying, but if we hadn't generated the money for this, none of this would be happening.
That's right.
It wouldn't even exist. It wouldn't be then as soon as we walk out the door. So I said, look, you're going to help me get that grant from so-and-so and so. Are y'all going to put enough money in that account for so-and-so and so-and-so?
Yeah.
But the fact that you're brave enough to say that government makes a difference, I appreciate it.
It does.
Because you are.
If it wasn't for the Voting Rights Act, we probably, you and Dr. Deere probably wouldn't be here right now. I want to draw my attention right now to pharmacist Edwin Muldrow. And the reason why I say that is because you actually, in a medical setting or a quasi-medical setting, hit more black folks on a continual basis than any of the doctors that exist in the Cook County health system. What specifically are you telling them with regard to vaccinations and the importance of it?
First of all, I want to again thank County Commissioner Darryl for inviting me to be here. What we've done and been doing prior to the vaccine is promoting vitamin, nutrition, and herbal supplements. For instance, we recommend alkaline water. I can get right to the specifics. The fatty acids, I recommend coconut oil, vitamin D3, 5,000 IUs. Yeah. And then me personally, I like the elderberry, which is high in zinc and vitamin C. So engaging my patient customer base prior to was allowing people to take control of their own healing and fight. But now that we have the vaccine, so this is a tool for us to return back to normal. Yeah. So since we're here at Pastor Miller's House of Worship, I look at the vaccine as going to church on Sunday. You know, this is our salvation. But
have you been baptized in the vaccine?
Absolutely. But continuing with your vitamin, nutritional, and herbal supplements, that's paying your tithes.
Okay.
As Pastor Miller would say, but faith without works is dead. So you must continue with your nutritional supplements to fortify your immune and boost your immune system up to give you that peace of mind and that confidence to continue to fight, because we don't know what's coming behind this. Yeah. So that's my formula for being proactive. And the responses that I get from the customers, they gravitate to it, they grasp it, and once you can make that connection with a person, now you can talk and promote healing. So that's been my message prior to and as of today. So I've seen an uptick in my customers trying to reach out and find out where to become vaccinated.
And where can they come? They can come to 2622 West Jackson Boulevard.
Absolutely. Absolutely.
And we got gifts for you and other little trinkets to encourage you to get vaccinated. And the nice thing about it, because if you don't have insurance, you got to pay for that prescription, right?
Absolutely.
Is there a charge for this?
No, it's not charged for a visit, but the vitamins aren't free.
I want to, Dr. Deere, if I'm not mistaken, you have your doctorate in psychology, right?
Correct.
Indeed. What is the mindset, the barriers with regard to critical thinking that we have to break down to get people in our community to say, yes, I got my shot?
Well, I think first and foremost, we have to change the mindset. I think Congressman Davis hit it really hard in that we have been impacted by many, many years of being beat down, being oppressed. That has clearly changed the way that we think, and it oftentimes changed the way that we believe about ourselves. I think Carter G. Woodson said it the best. He said that if you can cause a person to believe certain things about themselves, which Pavlo called conditioning, you no longer have to tell them to go to the back door. They're going there without you having to tell them. And if there's no back door there, guess what? They're going to make one. So I believe conditioning has happened in most of our community. And what we have to do is ensure we can recondition individuals to think differently by education. There's an old proverb that says education is never neutral. It's either liberating or oppressing. That means that education will either set you free or put you into bondage. I see what we're doing here is about education. It's about helping people to understand. I had no idea what Dr. McGuire had talked about as it relates to individuals who are pregnant or thinking about getting pregnant, right? And I'm chair of health and hospitals, and I've been immersed in vaccination stuff for the last year or maybe even more, and have done many town halls and sat on many panels, but today's the first day I heard that one. So I'm delighted. We'll continue. I don't care how many PhDs you might have, you don't know everything. And so in our community, we have to ensure that we are helping to educate individuals. Now, we already know we smart in our community, but you can't be smart. I can't go and fix your car because I ain't got no PhD in auto mechanics, right? So I can help you with your mind, but I can't fix your car. So all our people out there are smart in a lot of stuff, but vaccinations you might not be as smart in. We want you to listen to the experts. I've been vaccinated. My family has been vaccinated. They just opened it up. So my daughter, who is the last in our house, who was not vaccinated, has gotten vaccinated. And look, I didn't have to ask my children about vaccination, right? I didn't have to tell them about vaccination. They saw what their mama and daddy did, right? And they said to us, hey, the first time I've got 19-year-old college students. They say, Dad, look, when you go get vaccinated, take us with you. I said, I can't do that.
And you know what? And they're kind of old right now because under Pfizer, if I'm not mistaken, Dr. McGuire,
That's right.
the Pfizer vaccine can now be administered to 12-year-olds. And whenever I try to communicate to people, I always try to put it in what I call a layman's understanding. We can engage in hyperbole and be somewhat pedantic when we speak. But the reality is that we're here to dispel these kind of myths associated with vaccination. And one major myth out there is that it's going to cost. I don't have insurance. I don't have Medicaid. Where am I going to find the money to pay for vaccination? Because as soon as I go up there, they're going to ask me whether or not I have insurance. Dr. McGuire, what do you say to that? I'm sorry, Dr. McGuire, Dr. Emery. Matter of fact, let me edit. Dr. Emery, what do you say to that?
I say the vaccine is free and that you can come here within the next 3 days and get it. You don't have to have insurance. You don't have to be an Aetna member. You don't even have to be documented. So undocumented people will be vaccinated as well. So I just encourage everyone in the entire community. There are no barriers to you being vaccinated in terms of cost or in terms of insurance status.
Congressman, go ahead.
Reiterate why it's free, though.
Well,
Let's reiterate why it's free.
It's because of let's, again, praise the leadership of current President Joe Biden in terms of what he was able to do with the America First, what was it called again? The America Rescue Plan.
I think it goes even beyond that. In Cook County, there's no reason for any individual not to be able to acquire health care. There is a network of federally qualified health centers you can go to if you don't have one dime. And then if you decide you don't want to go to them, you can go to the Cook County health facilities. The county of Cook is mandated to provide medical care for indigent medically individuals. I'm saying that's one of the main reasons that county government exists. And you don't have to have a quarter.
That's right.
You don't have to have 30 cents. 50, you can go and enroll, get yourself a primary care physician, go see them when you need to, and you can be healthy. And so Cook County is not a bad place to be able to get health care.
I'm going to be honest here. I've been in Chicago long enough. There are a lot of people that say it with pride that I was born in county, which is now Stroger Hospital. They wear that as a badge of honor. And in fact, if you suffer from some type of critical wound, then if there's a place you want to be, you want to be at Cook County or Stroger Hospital. One of those other safety net hospitals, of course, is Roseland, where you're at, Dr. McGuire. And what are you trying to say to women there, both of the childbearing age and older, about the misconceptions they have to getting vaccinated?
Yeah, and we do a lot of education. I do want to, emphasize the fact that personally I'm out in the community at churches, in the Roseland community, educating the community about how important it is to get vaccinated, to dispel a lot of the myths about vaccinations, helping them to understand how the vaccine works, letting them know that this vaccine, even though the media used words like warp speed, it wasn't something that was just developed at a whimsical amount of time, that this vaccine underwent the critical testing and trials that it needed to go through.
And I want to touch on that point, because the reality is this, with regard to people's hesitancy about taking the vaccines. A woman, Kinsey, I believe her name is, was one of the main developers of the Pfizer vaccine, right? And secondly, individuals like you, Dr. Emery, individuals like you, Dr. McGuire, individuals like you, Brother Muldrow, have dedicated your life to health care providing. And I think it's disingenuous for people to look at Black healthcare workers and all of them coming out with the same message with regard to vaccinations and think that we're involved in this covert conspiracy, to cause us, to go to the concentration camps of the unvaccinated.
Yeah. When we talk about the Tuskegee experiments, that's another thing that I do educate on. That was an example of treatment being withheld to see what would happen to these men that had syphilis, not treatment that was given that harmed them. And so all of these stories, though they bring up in the community, but it's really about the repetition of seeing physicians that look like them, seeing people that really care about them, and the repetition about the education on how the vaccine works and how safe it is and how it went through the testing and the trials. And the fact that the Moderna or the Johnson & Johnson vaccine actually had 20% or more African Americans and
That's right.
Latinas in their study group.
In their study group.
So a lot of hesitancy is that it wasn't studied on us, but it was studied on us.
Yeah.
So education is key.
Education is key, and also, as a Black woman, how do you break it down, as I suggested before, in terms of layman's terms, sister to sister?
The way I break it down is I ask them, why don't you want to get vaccinated? I try to get an understanding of why, and many can't give me a reason. You know, they'll cite something that they saw on Facebook or something that they heard from a girlfriend.
Do not get your news from Facebook.
Do not get your news from Facebook.
Go to real, reliable, vetted news agencies that have the journalists that do the hard legwork, that also are dedicated to veracity to get your news. I have to put that out there.
Right. And then I talk to them honestly and transparent with the people that I see. You know, I see young Black women, unfortunately, who die from COVID.
I see you shaking your head there, Dr. Emery.
Yes, so I think all of us on the panel have likely been personally affected
Yeah.
by COVID, and we've lost someone, or we know someone
That's
who's
right.
lost someone. I have a friend who's a physician who lost her husband early in the pandemic, and his mother. And
It's real.
it is real. It is not, just on television. It's actually happening in our lives.
And speaking of television, Congressman Davis had alluded to it at the opening remarks that he had in terms of the suffering. You don't want to believe that COVID is real. You watch with an open mind those pictures right now that are coming from India, where people are fanning people in monsoon rains and trying to fan them because it looks as though maybe I can try to break up this heat that's on them as they grasp for air. And there's no air that can come inside their lungs because they need a respirator. And you say that COVID-19 is not real. When you look at Aetna's role, Dr. Emery, as one of the largest health providers in the state of Illinois, what is it that you want to say to those that are watching right now?
Well, I think it's incumbent upon all of us in leadership, all of us in healthcare, to do what we're doing today, which is to educate and to communicate and to get the word out there, and also to be an example. I think, all of us, as we said earlier,
Are vaccinated.
have been vaccinated.
Yeah.
Right. Our families.
My family's been vaccinated.
Exactly.
And I got a young millennial,
Right.
hip hop daughter and, and an artist's son, and both of them got vaccinated. I'm like, oh, okay.
Right. And now, as you said earlier, 12 to 15-year-olds can be vaccinated. So I think it's important that we make sure our children are protected. If we're protected, we need to make sure our children are protected. And that will help towards herd immunity, which is where the majority of the population have either had COVID-19 or been immunized against it. And so the virus will have nowhere else to go. It'll essentially burn out if you think of it as a fire or a flame. So that's what we're trying to get to. When you mentioned herd immunity earlier,
Right.
that's the goal.
Indeed. In fact, the president just came out with a new goal in terms of vaccinations toward herd immunity. Father Dowling, as we get ready to wrap up here, and I'm going to get closing comments from everyone, talk to me about the intersection of faith and vaccination.
So for me, faith is really important, and faith from our perspective is not just about spirit, but it is about body, mind, and spirit. It is about how do we strengthen all three, because all three are intimately connected. And so how do we strengthen our bodies so that we can continue express our love, our concern, continue to share our gifts with others. And so it's always about how we convey that to others. The other thing that I think is important from a faith perspective is that God continues to work in our lives to provide resources. He gives us, science. He gives us doctors and nurses. He gives us pharmacists. He gives us lots of different people in our lives who we need to recognize as important, which is why whenever someone goes in the hospital and says, Father, I want you to pray for me, I always say, well, I'm going to pray for you, I'm going to pray for your family who's there to support you, I'm going to pray for your doctors and nurses as well. So we're going to do that all together because we're all important in God's plan, and everyone is serving God in their unique role of what they do, and that includes our researchers, that includes doctors, nurses, all the frontline workers. It includes our communities of faith working together, which means we need to encourage each other, we need to lift each other up, we need to challenge each other compassionately to do the right things that are going to strengthen our body, mind, and spirit, because we need all of those at their fullest potential to really share the fullness of who each and every one of us are.
Indeed. Brother Muldrow, what do you say to your colleagues out there? And the reason why I stress this is because even though I have great health insurance, there are times where if, I want to do something to treat a seasonal allergist, I don't call my doctor. I'll just go to my pharmacist and say, hey, what do you recommend? And what do you recommend for your pharmacist to do to help break down these barriers that exist to our confidence in vaccination?
Okay, so during this entire pandemic, I've been open every day with the exception of Sunday.
Wow.
So,
and that was even during the uprisings that we had during the George Floyd and Breonna Taylor incidents.
Didn't miss a beat, no destruction, no interruption of service. I have to include my wife as well. She's a nurse at Loyola Hospital. We were basically like going to work on empty streets. All our neighbors were restricted to their homes, and we're coming and going and waving at everybody.
Because people still needed their medicine.
Yeah. So I've heard and experienced all the firsthand stories of COVID from my wife every day coming from the hospital. So for me in particular, I'm on the front lines, so I have a unique opportunity to embrace people. So the advice that I give or share, I have to be respectful and legitimate because I'm on the front line. So if I give someone some bad information, I can't hide behind barriers or buffers. So what I say, I give honesty, and the people respect my integrity. So, as I said previously, the vaccine is a powerful weapon for all of us to get back to life. And I continue to stress, take your vitamins, take your herbs, get your 8 hours of sleep, start exercising, 30 minutes a day, get your cardiovascular, just simple common sense stuff, just to satisfy your peace of mind. Because when you're helpless and you feel like, because we've all been helpless through this, we don't know. This is something that we've never had before. So when you can get out in front and do something for yourself, it allows you to listen to the professionals like myself, like Dr. McGuire right here, and let's all fight for life. And that's basically what it is. Just be honest with the people. And, I even say Commissioner Diggs, I know where his office is. We're right on the front lines. People know where we are 10 hours a day. So it doesn't behoove us to give misinformation around here.
That's right.
So that's my only message.
So I'm just going to take that phrase that you stole from Loose Ends in terms of back to life. And Commissioner Deere, I'm sure you heard of that song, even though you're a young man. This is how we get back to life, by telling the truth, by dispelling the myths, by promoting confidence. And in closing, for the people that are watching and listening right now, what is the message?
The message is, this is a no excuse campaign. There are no excuses. There's no reason why you do not need to get vaccinated. You've heard the professionals here. You've heard the clergy here. You've heard the elected officials here. There's no reason. There is no excuses. If you're online, do a hashtag to all your followers and say hashtag no excuses, get vaccinated. And I think that is the message that we have to send out. We are sending that out even in Cook County, where we have clinics everywhere giving vaccinations. We have Cook County Hospital and Providence Hospital doing vaccinations. But I'm even more encouraged to have insurance companies like Aetna out here in the community and healthcare companies coming out in our community and saying, get vaccinated. There are no excuses. And I've already requested a copy of this because I want to send it out. I want to make sure people are educated. And I'm asking people as I turn over my mic, because I got to get to another appointment. I'm asking people, listen, Black people, Juneteenth is coming up. It is, and we are holding a big conference, right? Half of it's going to go online, half of it's going to be in person, but we're going to be talking about this same stuff at Juneteenth. Now, Juneteenth is about liberation, and where Black people were liberated. And guess what? We just passed it as a paid holiday in Cook County. That's right, it's a paid holiday. And the state is this close to getting it passed. But listen, it ain't about a paid holiday, because you won't make it to Juneteenth if you don't get vaccinated.
Yeah.
All right? God bless you all. It has been a privilege and a pleasure. Anywhere where Congressman Davis is, I'm going to be there, because I know that I will be inspired. But I done met some new friends with Dr. Emery and Dr. McIntyre and Brother McGuire.
I said it.
And our clergy, where they are at, I'm at. We got to get this done. God bless you.
Indeed. And Dr. McGuire, you alerted us in terms of pregnant women being part of that high-risk group with regard to vaccinations. We know that communities of color disproportionately have health disparities that would put them in high-risk groups, whether it's diabetes, whether it's high blood pressure, whether it's cardiovascular disease. What is it that you want to say in closing to repaginate their thinking with regard to getting vaccinated?
Well, I just want in closing just to say, you know, as a healthcare provider, if you are pregnant and you still have questions about getting vaccinated, talk to your physician. Talk to your doctor. Get additional answers that you may need, but get vaccinated, because the alternative can be deadly.
Indeed. Congressman Davis, before we get closing remarks from our host physician, Dr. Emery, much has been done by the federal government. Still much more also needs to be done. Final words of encouragement as we are reaching positive thresholds with regard to the vaccination rate?
I think at the core of life is education. It is so important. A lot of people have said different things about it. Dr. John Brown Watson said that the aims and purpose of education is to know God and the laws and purposes of his universe. Malcolm X said that education is our passport to the future, for tomorrow belongs to those who prepare today. But I really like something that Abraham Lincoln used to say a lot. He was not the originator of it, but he used it. He said that education makes a man easy to lead, but difficult to drive. Easy to govern, but impossible to enslave. And so while individuals have a right to think and believe and whatever it is, and to express all of that, but they also have a right to be wrong. They have a right to be ill-informed. They have a right to not only endanger themselves, but they also endanger others when they don't do what is essential to stop the spread of a virus that can consume us all. And so you're not only doing yourself a disservice, but you're doing me in my house. You're doing whoever you come into contact with a disservice. I mean, I almost panicked when the fellow was tested because we felt for a minute it was going to disrupt our whole operation. Like you, we've never been closed during the pandemic. We're open on Saturdays sometimes. I get phone calls on Saturday. And so I'm thinking all my staff, people are going to be shut down. Can't nobody come to work. Everybody got to be quarantined in their home, and we would be just disrupted. I just want to thank one of my staffers for we have managed to very directly get more than 10,000 people vaccinated at events that we've put up. And I want to thank Nicole Harvey for being the coordinator of that activity. We will do some more. We don't believe that you can lead where you don't go. And we don't believe you can teach what you don't know. I don't believe that just talking about something is enough, that an ideology is not sufficient. We also have to be involved in the practice. So whatever we talk about, we attempt to do. And I want to thank again Aetna. I want to thank Reverend Miller. I want to thank everybody that is engaged, Wyona Redmond, in this process of trying to get as many of our people vaccinated as we possibly can. So Darryl, thank you very much.
And thank you, Congressman Davis. It goes without saying that we also want to thank Aetna. And for closing remarks, we turn it over to you, Dr. Emery, in terms of representing this particular panel discussion in terms of the necessity for vaccination and having confidence in them.
Great. Thank you so much. And on behalf of Aetna, I do want to thank every single panelist for sharing your personal stories of having had COVID, for sharing your insights, and all very valuable. And as we said, we've all learned something since we've been sitting up here ourselves. I think one of the things that Congressman Davis just said is that it's a personal responsibility. We're responsible not only for our own health, but in terms of getting vaccinated, it's a responsibility to our community, to our family, and to our friends. So when we get vaccinated, we're protecting all of those people, not just ourselves. And I think each of us, if we think of that, and we think of, our grandmother, we think of our elder mothers, we think of our children, we don't want any of them to become sick. We don't want to lose any of them. And so I would just encourage everyone in the sound of my voice, under the sound of my voice, to come out within the next 3 days to our vaccination center. We hope to get 10,000, but probably not. But we hope to get as many people as we can to come out so that we can make a dent in this and make sure that everyone is eventually vaccinated.
Indeed. And if you are even unable to make it here within the next 3 days, the reality is that you can go anywhere. You can call 311 in your community. You can call any hospital. The vaccine is available literally everywhere. It's even available at your barber shop. It's available at your pharmacies. Please take the time to get vaccinated. Take the time to be somebody that brings us back to life as we are used to. We thank you so much for joining us for this all-important discussion. The best thing you can do is to get vaccinated. Take care.
So good. Outstanding. I want to be like you when I grow up. That was